Some of the commonly overlooked physical signs in the pre-hospital arena include arm drift, which is a component of the Cincinnati Stroke Scale. It's something that needs to be actively looked for and can't just be seen just by looking at the patient. Also, evidence of bruising. If the patient doesn't get a complete physical exam, looking over their back, their sides, their torso, their proximal extremities, they might be covered by clothing and the frequent bruising could be missed.
I just have two caveats that I could think of for a physical exam in the older adult. One is be gentle. Their skin tears easily, they bruise easily, they're fragile. So be gentle with elderly patients when doing physical exam. The other one is always remember to check a blood glucose level. Even if a patient's blood glucose is like 180 or 200, it might not be a cause for immediate concern, but keep in mind that their blood is more likely to agglutinate, is going to be thicker and therefore more likely to clot.
When it comes to physical findings in the older adult, one of the things that I think it's important for EMS providers to be aware and observant for are changes that might suggest that an older adult was at risk for elder abuse. And so the things that EMS providers might look for are signs that that individual has been abandoned. So does their home suggest that they've been left unsafely? Does the comment of that individual suggest that they feel like they don't have the necessary support system in place? From a physical perspective, are there bruises, particularly bruises on the insides of the arms, of both arms, on the insides of the thighs, might raise a red flag for the possibility of abuse of the older adult. Fractures that are healing at varied states might also suggest elder abuse. Elder abuse is one of the things that as a society we probably could do a better job of being aware of and intervening upon. And I think EMS providers are well suited to identify situations where this might be occurring and raise that red flag so that people can be evaluated. The other things on physical exam that might suggest elder abuse are things that suggest poor care. So burns, perhaps difficulty with urine burns, things that suggest poor continence management, skin breakdown over sites of pressure. All of these things might raise red flags in the EMS provider that they could then communicate with primary care providers or emergency medical providers to investigate a bit further to ensure that older adults are properly cared for.
Those of us in EMS are in a unique situation to be going into the environment in which these elderly people live. And so frequently we might be the best person to make a recommendation about getting social services involved or suggesting to family or other healthcare providers some recommendations about whether they're in the appropriate place for their situation. I remember one call I went to where an elderly man was sitting in a chair and he was having trouble breathing. Well, he was also hypothermic and had severe pneumonia, and his O2 sat was down in the 50s. He was in very bad shape. He was in a room full of garbage and on a floor that had no carpet. When we got him into the ambulance and we had done everything we could to help his breathing, we were bringing him to the hospital, I noticed that he had a lot of sores on his torso and underneath his armpits. And when we got to the hospital, the physician there said that those sores asked us if he had been sitting up in a chair, and he thought those sores had been caused by the family tying a rope around him to hold him up in the chair so that he didn't fall out of it. And so his opinion was that that patient had been living in the chair upright for he didn't know how long, but those sores didn't develop overnight. And so for that patient, a social services recommendation was made, as well as a report regarding elder abuse. And so I think elder abuse is something we also ought to consider frequently when we're going into the environments in which these people are coming from.